Hi, everyone. Good evening, and thank you so much for joining us for tonight's webinar. My name is Michelle Richard, and I'm here on behalf of Scleroderma Atlantic, and I'll be moderating tonight's webinar. Tonight's webinar is Managing Pain and Fatigue, and back to lead our webinar is Vanessa Cook. And for those of you who are joining us for the first time, I am going to take a moment just to introduce Vanessa. But before we do that, I'm just going to read you our disclaimer. Scleroderma Atlantic in no way endorses any drugs or treatments shared within this webinar, and it is recommended that all drugs and treatments be discussed with your physicians before proper evaluation and treatment. As well, we'll have our questions towards the end of the webinar, and there are a couple of ways to ask those questions. If you're joining us on your computer, there's an icon located at the bottom, and you can click the Q&A bottom screen and type in your question. If you're joining us from using your tablet or iPad, you'll find that button at the top right of your screen, and you can also type in there and send us your questions. So like I said, thank you for joining us for tonight's webinar on managing pain and fatigue, and we're happy to have Vanessa back. And again, for those that are new for tonight's session, I'm just going to read an intro on Vanessa again. Vanessa Cook is a naturopathic medical student based in Toronto and completed her psychology degree at Western University. Her journey as a scleroderma patient is the driving force behind her passion for holistic healthcare. Along with a role as the chair of patient support on the board of directors for Scleroderma Canada, Vanessa also works in research with Scleroderma Patient-Centered Intervention Network, known as SPIN, focusing on projects aimed at enhancing the lives of those living with scleroderma. She's dedicated to continuing the patient-centered work, particularly autoimmunity and women's health. Vanessa's holistic approach to healthcare reflects her commitment to making a lasting impact on individuals dealing with scleroderma by integrating personal experience, academic knowledge, and research expertise. And we are so happy to have you back again with us, Vanessa. And I'm going to turn it right over to you.
Awesome. Thank you, Michelle. You always give a great introduction, so I appreciate that. I'm going to start by sharing my screen. Let's see if this will work. It says only host can share screen, so I might need the ability to do so.
Give it a try now, Vanessa. It should work.
Beautiful. We are all good. And then I'm going to get this open to Canva. Maybe Michelle or Mary Ellen, if one of you can just give me a thumbs up or let me know once this is in presentation. Is that okay? Everyone can see that all good?
We can see it.
Beautiful. Okay, awesome. So these next couple of slides always stay the same. This is obviously our series on integrative approaches to managing scleroderma, and it's kind of looking through a naturopathic lens on our approach to health and living with scleroderma. Just some of my disclosures before we get started. So I work with SPIN, as Michelle mentioned, and that's with the Lady Davis Institute of Medical Research. I'm also a Scleroderma Canada board member. I attend the Canadian College of Naturopathic Medicine, and then this is brought to you by Scleroderma Atlantic. A very big disclaimer here, this is not intended to be medical advice or intended, and it's very much intended for self-educational purposes. So the information shared is not a substitute for professional medical guidance, diagnosis, or treatment. Always consult qualified health care providers with any questions regarding medical conditions or treatment options, especially if you potentially get an idea from one of these webinars. I always encourage everyone, please go talk to your medical doctor, your naturopath, whoever you're seeing, for a second opinion and dosing and whatnot like that. Michelle did a really great job. Essentially, I was diagnosed in my second year of university. If you've been along for the series, I've repeated this a few times too, but was diagnosed in my second year of university, but they believe I was living with scleroderma since I was around 10 years old was when I started getting symptoms. And ever since I was diagnosed, I kind of found that I wanted more from healthcare and I wanted more answers. And I knew that there were things that I could do in my own life, and that I found a lot of empowerment through naturopathic medicine. And that's ultimately what led me down the journey to want to be a naturopathic doctor and kind of led me to where I am today. With our breakdown, we only have 2 more. This has gone by so fast, but we have another webinar coming up in April. It is always on the last Monday of every single month, and always at 6 p.m. my time. So that's EST or AST 7 p.m. And that's April is going to be on understanding hormonal health and scleroderma care. And May is going to be kind of looking at everything from a very holistic lens, talking about everything that we've discussed and how we actually apply this as scleroderma patients. So long-term strategies and sustainable habits using what we've learned in the last couple of months. So going into pain and treatment. So there are many different pain sources, as we know, in scleroderma. So therefore, because we have multiple different organ systems that are affected by the disease, we therefore need a targeted approach. So understanding the mechanism behind each and every pain source, is this musculoskeletal pain? Is there a psychological component to the physical pain? That's going to really help us with treatment. And I always say living with scleroderma affects many different aspects of our health and well-being. Therefore, in order to have kind of optimal treatment, we want integrative approaches in order to target those different areas of our lives. We're very different people and have very different schedules and management and techniques and all of these things. And how can we actually have an approach that targets and fluctuates as we do as people? So going into the different types of pain, this is going to be a longer slide. Starting with musculoskeletal pain, that is MSK pain. This is essentially looking at the pain in our muscles, tendons, and joints. We'll talk a little bit about it later on too. For joint pain, in the literature, this is the most prevalent pain that we see in scleroderma as it affects majority of patients. So studies have reported up to 79 to 80% of patients are affected by some kind of joint pain, and joints being, this can be in our hands, in our wrists, in our knees, feet, etc. So the small and the big joints in our body. With Raynaud's affects much more than half of patients, and oftentimes it can be one of the first symptoms that people start noticing, especially for people with the former crest pathology of the disease as well too. So we'll discuss this also later on in the presentation. Itch is something that occurs in scleroderma. However, the mechanism is very poorly understood. So what we do know is that the skin tightens and we experience sensations of itch, but the skin also dries out, which means we experience kind of this painful sensation, and it can be very irritating to many patients, including myself. So what we do know is that damage to small blood vessels in patients can kind of perpetuate the itchiness. And it is understood that itch affects around half of patients with scleroderma. So not every patient with scleroderma is going to be experiencing itch. However, there is a good, not majority, but around half people that are going to experience that too. For neuropathic pain, this is a type of pain that can be extremely complex, but it is less common for patients living with scleroderma. There may be some of us on the call that experience this. So just to break it down, this occurs when the nervous system, in very lay terms, kind of malfunctions or gets damaged. So our central nervous system is known as our spinal cord and our brain, whereas the peripheral nervous system is known as the parts of the nervous system that are outside of the brain and spinal cord. So we're thinking of the nerves that extend all the way to our fingertips, all the way to our toes. Throughout our body, we have a lot of different nerve structuring. And if we have any damage in any of those areas, then this can lead to a lot of different and very uncomfortable types of pain. So sometimes this can present as like an electrical shock down the body, squeezing pain, burning pain, sometimes numbness and tingling too. It can almost kind of mimic sometimes Raynaud's, and there's a little bit of back and forth between the neuropathic pain and Raynaud's as well too. So that's neuropathic pain. Chest pain can result from heart and lung diseases associated with scleroderma. such as pulmonary hypertension, leading to chest pain, shortness of breath, and then other cardiac symptoms and causes with scleroderma can lead to pain and palpitations. However, sometimes this can be related to an underlying cause. We also see shortness of breath and sometimes chest pain related to anxiety and depression, which we do know comorbid in scleroderma as well too. Another cause of chest pain too, which I didn't know this affects me personally, which is why I'm so interested in it, was costochondritis. And I don't know if anyone's heard that term before, but it's essentially the muscle, like the musculature in the chest. It's not anything to do with the heart, becomes very tight. We sometimes see bikers get this pain too because they're leaning forward and their chest is always contracted, but also people living with scleroderma, which is something I didn't know when I was first diagnosed. We have this shortening because everything is pulling in. We have that skin tightening and musculature that's going on, tightening the musculature, and it can cause a lot of stabbing pain in the chest too. So we oftentimes think, when you're getting that stabbing chest pain, you start to panic, it could be a heart attack. Also, I'm so sorry, my cat Heidi loves to come up whenever I do these webinars. But anyways, yeah, so a lot of chest pain, and it sometimes can be musculoskeletal in nature. It may not be related to the heart, it may not be related to the lungs, but nonetheless, it's very important to figure out where that chest pain is coming from and talking to your doctor, etc. We talked about joint pain. Surgical pain is obvious. If we're having post-operative pain, and usually we are prescribed some type of pain reliever with that too. Ulcers can be a really big one. This can generally come from our Raynaud's when we're not getting enough circulation to the area. But then we also see this too in gastrointestinal ulcers, and that can be a source of pain, as well as facial pain too. We have the tightening, the microstomia, where the lips become smaller. So just kind of going over different pain sources too. I'm sure many of us may have been affected by some of these pain sources at one point or another. So to dive a little bit deeper into each pain system and chat about treatment strategies, we're going to break this down a little bit further. So for musculoskeletal pain, which is something that really affects people living with scleroderma, generally they require some sort of manual release or activity, at least from a naturopathic standpoint. So when we're looking at physical therapies, we see this being crucial in managing some scleroderma symptoms, as it can improve joint mobility, function, reduce contractures. So if we have contractures in the hands and feet, which is something that obviously affects many people living with scleroderma, we can use this to, have targeted stretches, or even on our own, there are different YouTube videos and whatnot that we can look up to do daily stretches to help alleviate pain and then also reduce contractures too. So that can be a really effective treatment that we can use. It can help reduce stiffness, prevent joint deformities, improve overall mobility to the affected areas, and then specialized therapies, which we'll talk about a little bit later too, like hot and cold therapy, may also be used to reduce pain and inflammation. Acupuncture may be used to manage pain, stiffness associated with scleroderma. So this is inserting the needles into specific pressure points or acupuncture points aimed to promote relaxation, improve blood flow, and then also alleviating pain. If we're using it in a musculoskeletal way, that is different than kind of the traditional acupuncture way. So musculoskeletal, sometimes you'll see physios doing acupuncture, and they generally will use it for trigger point, or we do electroacupuncture as well too. So trigger point acupuncture is where you are inserting the needle into a muscle that is very tight, very hypertonic. So we're thinking of that muscle being really, really tight. And then when we insert that needle and kind of break up the muscle, for lack of better terms, we see that release. I've had it done. I do it on patients often too. And it can sometimes feel like almost like you did a big workout or you got a massage and you feel that kind of release. So that is always an option too. And you can see a physical therapist or a naturopath to do acupuncture, especially for people who may have really tight muscles. That can be something that can be quite effective that we use. Physio exercises, so this is similar to the physical therapy, but gentle exercises that are tailored specific to the patient that they're using can be highly beneficial. Again, maintaining joint function, reducing muscle stiffness, preventing contractures, and it can be very effective as well too, and something that we can do at home, which is super beneficial. For workouts, we'll talk a little bit more about what this actually looks like as well too, but doing low impact, regular physical activities such as walking, swimming, cycling, anything that you're able to do or that is available to you, helps maintain obviously our cardiovascular health, improve muscle strength, but also reduces fatigue. So we're finding that we have this better circulation, better stamina, which can also help reduce stiffness and muscle weakness. There's obviously a big balance with this too. However, when you overwork, sometimes you get really hypertonic tight muscles, but then the benefits always outweigh the cost when it comes to physical activity and finding a low impact exercise that is beneficial for you. I'm very biased. I teach Pilates and I teach barre, and those are both low impact exercises that I think can be fantastic, especially if you're doing this from home, maybe doing this on the ground, potentially yoga too, and just finding an exercise that resonates with you that you're interested in and something that we can add into our daily lives. In terms of sauna, known as heat therapy, this can always help with relieving pain, relaxation, improving blood flow, especially to the skin, and the warmth may reduce stiffness in the muscles as well as the joints. We see a lot of evidence coming out on different types of saunaing too. The one thing with sauna is we obviously want to stay hydrated if we are in the sauna, and then not being in the sauna for too long as well. So for some individuals living with scleroderma, heat treatments like sauna helps to relax those hypertonic muscles. And like I said too, it is very essential to monitor any adverse effects, especially if you have any internal organ involvement, just making sure that that's double checked and okay by your doctor. Stretching is also a huge one. I think anyone can benefit from integrating stretching into their daily routine, even if it's a morning stretch, a night stretch, but actually having, a dedicated time in your day where we stretch out our muscles. This can improve flexibility, prevent contractures, and regular stretching can actually reduce stiffness in the skin and muscles. And we see this being quite effective, especially for people living with scleroderma. So improving our range of motion, actually getting to that full range of motion if we have reduced range of motion in any area of our body, and can be done gently, avoiding aggressive and painful movements. I always love looking up physio videos online on different stretching, especially for the neck, can be quite effective too. Those are great tools that we have in our toolbox and are super accessible to most people. So then going on to supplementation, there are quite a few very evidence-based supplements that are used for muscle recovery, muscle stiffness, pain, etc. Magnesium is one of the most, I want to say, accessible ones. There's two different types that we use for the muscles. Magnesium malate, we always remember this because M is muscle, so malate is kind of for muscle recovery, but then bisglycinate is generally the one that is absorbed the best too. It also helps with sleep, helps with recovery, with all of these things. So magnesium is one that we generally prescribe first line when people have musculoskeletal pain. It's super easy. Majority of people are magnesium deficient anyways. So introducing that into, a nighttime routine can be really beneficial for people who experience this pain. My next two are starred, and very greatly starred too. I don't necessarily always recommend people with scleroderma to be taking creatine or L-carnitine because they do put stress on the kidneys. And if you already have kidney involvement, that's something we don't even want to go near. However, there is a large amount of data. Creatine, we always say, is one of the most studied and well-researched supplements. So there's a lot of evidence for creatine, both in muscle performance, maintaining muscle mass, muscle protein synthesis, but then also recovery as well too. Same with L-carnitine. However, like I said, is it for everyone with scleroderma, let alone would I even recommend it to people with scleroderma? Not necessarily. And it's something that you'd really need to discuss with your doctor if it is something that you think could be beneficial. Curcumin, we know it's just, it's a derivative from turmeric. So if you have turmeric at all in your diet, but we use this a lot, especially for people who have joint pain. Omega-3, same thing, big anti-inflammatory ingredients. And then vitamin D, there is evidence that vitamin D can help with pain associated to fibromyalgia symptoms. So if we have any of those painful tender points and chronic musculoskeletal pain, particularly with those with vitamin D deficiency. So if you're deficient in vitamin D and then we start supplementing, we may potentially see some of that musculoskeletal pain reducing. In terms of nutritional support, we always opt for higher protein. The guideline, if you haven't seen my previous nutritional webinars as well too, the guideline generally, very generally, is around 1 gram per pound of body weight. So if you were 100 pounds, just for sake, we would be having 100 grams of protein a day. We want this to be anti-inflammatory, and then we're also looking at a personalized approach to recovery too, looking at whole food diets, anti-inflammatory ingredients like olive oil, nuts, seeds, fish, etc. All of these great things that we can add into our diet, and using obviously vegetables and fruit where we can get them in and where we can absorb them and tolerate them too. So valvular dysfunction, this is obviously Raynaud's. We see when we get kind of like these ulcerations here on the fingers. We know that we have that massive vasospasm that happens. So the vasculature kind of freaks out, for lack of better terms, and we lose sensation. So we start experiencing that numbness, tinglingness, extreme coldness that comes to the fingertips. And then also we can get kind of this damage to the blood vessels too, every time that a Raynaud's attack happens as well. In terms of hydrotherapy, this is better known as water therapy and involves exercises performed in water, typically warm water. And the buoyancy of water reduces the pressure on joints and muscles, allowing for easier movement. The one thing I always caution, ice baths are like such a huge trend right now. I'm sure people have seen this like all over social media where people are going in, freezing cold baths of water and just bathing in it and holding it there for a while. Obviously, to me, that doesn't seem particularly enjoyable, especially living with Raynaud's and Scleroderma. I never recommend it to anyone living with Scleroderma. We know the more we have our Raynaud's attacks, the worse that is for our hands, for the vessels in our fingers and toes too. So I definitely caution that. I have a major concern with it personally, but also we know it's just not something that is necessarily beneficial. So if you're seeing that contrast hydrotherapy, there is a way to do it that can be safe. If we're doing cold water that doesn't invoke our Raynaud's and then going into a sauna or some kind of putting it back into the hotter water, we may still kind of get that vacuuming effect of pulling things in and then releasing them in regards to circulation. However, we never want to purposely invoke that Raynaud's attack either. Hot packs can be super beneficial. So we are using these to relax tight muscles, reduce pain, and improve blood circulation by increasing the blood flow to the area. For people with scleroderma, we want to use something that is warm, not necessarily hot, to alleviate joint stiffness, muscle tension, skin tightness. Heat can also be used to relax the muscles in the areas that are surrounding contractures. So, if you have a sore shoulder, sometimes relaxing the muscles, even just around the shoulder and in the local area, can be even more beneficial than just relaxing the shoulder too. My consideration with this is to be careful and not use excessive heat or very hot packs, as they could irritate the sensitive skin or cause burns where the skin integrity is already compromised in people living with scleroderma. So just using something that is warm and using a barrier such as like a towel or a blanket if you're using an electric heat source. And then also for moisturizing for ulcers, skin moisturizer in general is super beneficial, but since scleroderma can cause ulcers, particularly on the hands and feet or other areas where the skin is tight and damaged, keeping skin moisturizers vital is very important for skin integrity and breakdown and supporting the healing of ulcers. Keeping them clean and avoiding infection is also extremely important too. In terms of vasodilators, the evidence for, I want to say, naturopathic vasodilators will never, ever be as strong as our pharmaceuticals. So some of us may be on like PDE5I. I forget the other very classic one that we put people with scleroderma on, but these are kind of may more be supplementary or something to keep in our back pocket if some of those aren't working. But yeah, nonetheless, I know that we don't have strong evidence for these. Something called ginkgo biloba. This is an herbal supplement that is thought to improve circulation by acting as a vasodilator. So some studies do suggest that it can improve blood flow, particularly in people who already have poor circulation. So someone living with scleroderma. It may be effective to relieve some Raynaud's phenomenon and improve overall circulation. However, more research, like I said, is needed to actually have, for us to know if it's actually effective in people living with scleroderma. It can sometimes interact with other medications. That is the one thing that I will say for vasodilators in general. If you are using a supplement that is known as a vasodilator, making sure it doesn't currently interact with any vasodilators that you are already on. So then to talk about the gut-skin axis. So there is a complex relationship between the skin and the brain. And this also extends into the gut-skin-brain axis, which we talked about. I believe it was our last one. We talked about the gut-brain axis. But this axis essentially looks at how we can modulate the brain through different types of therapy, hypnotherapy, to ultimately better our outcomes with our skin. And I know that sounds absolutely insane. Sometimes when I'm explaining this to someone who's never heard about it, they're like, what? That makes no sense. But since we have all of our neurotransmitters, that are in our gut, this can sometimes impact the way our skin has like an influence on us. So where the gut microbiota influences skin health and mental states through modulation of neurotransmitters and immune response, we see that there's a big tie between immunity, the skin, and the brain too. So sometimes integrating things like therapy or CBT can ultimately help with skin integrity, but also some things like itchiness, which we know has a big psychological component to it as well. So then tying into itchiness, the pathophysiology of itch is largely unknown and not well understood, unfortunately, especially from a research standpoint. We do know that some forms of this can come from an immune interaction with the skin cells, and this may be one of the reasons why we see itch occurring in scleroderma. We do know that skin tightening, dryness, inflammation, and the itch scratch cycle. So that's when we're itching something that feels scratchy, something that feels very itchy, and we're scratching it, that can actually perpetuate further itch. So it's very unfortunate, but when something is itchy, we always say try not to itch it, because as soon as you itch it, you're impairing the integrity of the skin, and then ultimately just keeps perpetuating this big itch cycle. Scarring and then vascular involvement also play a big role in chronic itch. Like I said, unfortunately, from a research standpoint, we don't know too much about itch. However, we do know different things that we can do to relieve itch as well too. So general pain relief strategies, we're looking at different ointments, creams, topicals, just to go into a couple of the botanicals that we have as well too. Starting with the emollients that we have, we want to use thick emollient-rich creams like petroleum jelly or ceramide-based lotions to help lock in moisture and help us stay hydrated. This is very important for dry, tight skin, especially seen in scleroderma. I always recommend people to use something that is I was going to say non-flavored, non-scented is what we want. So like your petroleum jelly is fantastic, something really thick too. And these help to reduce dryness, itching, cracking, and support overall skin health. Another type of cream that we use in terms of pain is capsicum, and this is essentially derived from chili peppers. And we know that it has pain relieving properties. So topical capsicum can reduce pain, muscle stiffness by desensitizing the pain receptors, and that's essentially how it works. And it's chronically used in chronic pain, and we see it used for scleroderma-related joint discomfort. To go into some of our botanicals that we use for general pain relief, also I'm just realizing I'm like completely never know when my E's and I's go back and forth, so please ignore that there. But we use something called boswellia, which is known as frankincense. It's a well-known anti-inflammatory herb, and we commonly use it to treat joints and inflammatory conditions. It's been shown to reduce inflammation, improve joint mobility, and can potentially benefit people living with scleroderma, especially if you experience joint pain, stiffness, or inflammation. Devil's claw, which sounds so scary. I don't know why it's named that. I believe it actually kind of looks, like a gray scary looking herb. Nonetheless, it's another anti-inflammatory herb, and we use it for joint pain and arthritis, especially for osteoarthritis. I see this being used quite a bit. It can be beneficial for reducing pain, inflammation, and again, for people living with scleroderma, may be something that we can integrate as well too. Ginger is something that we use as a powerful anti-inflammatory herb with a long history for various conditions. Oftentimes we use this premenstrually for people who experience menstrual cramps and pain. But we see that it can reduce inflammation, ease pain in joints, which can be particularly useful for people living with scleroderma. Eggshell membrane is a natural source of collagen as well as glucosamine and other joint supporting compounds, which is why it can be used. So some studies suggest that eggshell membrane can improve joint mobility and reduce pain and stiffness. And that's basically it. This also ties into the fourth one here, that is glucosamine. And glucosamine is a compound that's naturally found in the body that supports cartilage and joint health. Particularly with osteoarthritis, do I see glucosamine and curcumin often combined in treatment for people with osteoarthritis or arthritis in general, especially if we're having like that big pain sensation in the joints. Arnica is also a fantastic one. So it's a really well-known herb used topically to treat bruising, pain, and inflammation. Generally, you can get arnica roll-ons, anything like that too, sometimes different creams, and you can rub it on the areas that are causing you pain. The one thing that I will caution with arnica, actually any of these botanicals as well too, and supplements, is sometimes if people have, a certain allergy, just to make sure that you don't have the same allergy to any of these things as well. And that's more for like seasonal allergies, if you're allergic to ragweed or something that doesn't actually have an interaction with any of these herbs. So going into what is fatigue, since this is a webinar on pain and fatigue, fatigue is defined as an extreme state of tiredness or exhaustion, and it can play a big role in physical, mental, and emotional functioning. So unlike normal tiredness, which is temporary and generally relieved by rest or sleep, fatigue tends to be more persistent and can occur even after adequate rest. So it can impact daily activities, reducing our ability to concentrate, perform tasks, engage in social and physical activities. Sorry. There we go. Sorry, my notes decided to jump on me. So some fatigue mechanisms, we don't necessarily know all the time what actually occurs in every individual experiencing chronic fatigue. Dr. Mo Osmond, I don't know if anyone is familiar with him. He does some really fascinating research on fatigue. If you're ever interested, I highly recommend checking that out, especially if you're someone who experiences fatigue, especially chronic fatigue and scleroderma. But we do know that there is a role with chronic inflammation, disrupted sleep. This can be from mental and emotional reasons, or potentially even just having that organ involvement can sometimes disrupt our sleep cycles. Pain is often one that wakes us up in the middle of the night. Systemic involvement, like I mentioned, with internal organ involvement, mental emotional factors, nutritional deficiencies, breathing problems, and smoking have all been related to, different drivers of fatigue. And this is one that I wanted to talk about. Am I fatigued, tired, burnt out, or all three? So we often use fatigued and tired, burnt out interchangeably, but they are definitely three different things. So when we are tired, this is something that can be relieved by rest. We're sleepy generally, and it's very temporary. So, I'm tired, I'm going to go to bed, or I had a really tiring day, which is completely different than fatigue. Fatigue is generally not relieved by rest, and that's kind of how we classify it. Is someone experiencing fatigue, or do they have a really demanding job and they're tired? So it's not relieved by rest. It's kind of overwhelming exhaustion mentally and physically, exists in chronic diseases, and affects quality of life, impacting daily activities. So I always think of the story of someone living with scleroderma, and they would always say, I would get up and I'd make a sandwich and I'd have to go and take a nap. Like I was so exhausted after taking a nap, or I'd get up and, fold some laundry, and then I'd have to take a 3-hour nap because I was just so exhausted by doing that one activity. And that's kind of, to me, the difference between tired and fatigued. And I think fatigue extends from chronic fatigue to just mildly fatigue in scleroderma. But I think many people, if not sometimes all patients, are affected by fatigue in some way at some point in their disease. So it's something that we can all kind of resonate with is, you know, you get up one day and you're not just tired. It's like, I need to rest like the entire day. I'm not feeling good. And then this obviously extends differently to burnout. So burnout is more emotional, physical, and mental exhaustion. And generally we see this is caused by prolonged stress, often related to some form of work. So, you know, you have a really intense job and you've been working ridiculous hours at your job or doing X, Y, and Z. And we're noticing that we're experiencing burnout rather than just tiredness. You know, we've been in a really stressed out period for way too long. And we're not just tired, we're past the point, we're now burnt out. So some comorbidities, and I think these are very important to point out, especially for people living with scleroderma, is anemia. So comorbidities of fatigue and scleroderma. So anemia being a condition that when you don't have enough healthy red blood cells to carry adequate oxygen to our body's tissues. So this can be caused by various underlying conditions, deficiencies, and is categorized into many different types too. So iron deficiency anemia is our most common type that we see in majority of people, not majority, but in people with anemia. And it's caused by a lack of sufficient iron in the body. So iron is an essential for producing something called hemoglobin, the protein in a red blood cell, and it carries oxygen. So when we don't have that, we're not getting enough oxygen in the body too. We often see vitamin B12 deficiencies. I believe these are the second most common ones. Don't quote me on that. But it's necessary also for red blood cell production because vitamin B12 is what helps with that. And it can lead to the production of a deficiency in vitamin B12 can lead to the production of large abnormal red blood cells that cannot function properly. In addition, folate deficiency, this one is less common. However, nonetheless, it still happens. So if we have a folate deficiency, which is vitamin B9, this is another essential vitamin required for red blood cell production. And a deficiency in folate can lead to the production of abnormally large red blood cells. We also see too, so we're seeing this abnormally large picture with B12 and folate. We can also see the opposite. So we see smaller red blood cells, and we generally see that with iron deficiencies. You get something called microcytic anemia, and it can be quite common in scleroderma as well too. Something else is anemia of chronic disease. So this is a condition, it's a chronic condition that occurs when you have a chronic disease, and it's not because we have a lack of iron or B12, it's simply because we have the chronic condition. So as I mentioned, the vitamin B12, vitamin D is also a huge one too, that we see people experiencing fatigue, dizziness, etc. Same with anemia. So they can kind of overlap often too. Depression and mental health often mimic fatigue as well. And then thyroid disorders such as hypothyroidism. So you know, if this was me and I was treating a patient with scleroderma, vitamin D deficiency is something that we already know people with autoimmune diseases are at risk for. And generally, your rheumatologist or family doctor should be monitoring for this, regardless if you have an autoimmune disease, but then also checking for anemias as well, too, if we have someone that is chronically fatigued, because that's something that we can easily fix with supplementation or even diet interventions, too, and eating more red meat. And it's something that I think is very important, especially as we're assessing fatigue. So some non-farm interventions, looking at regular low intensity exercise has actually been shown to have an effect on fatigue. So I always tell people, you know, if you had planned to go on a 30-minute walk or an hour walk or however long it was, can we maybe break that down into something lower intensity to start? So can we do, you know, a 10-minute walk as opposed to, or 3 10-minute walks as opposed to a 30-minute walk, or maybe even a 5-minute walk, just going down the stairs and up the stairs, etc. And how can we break that down? Pacing kind of leads into this too. So this is the more prioritization, and this is actually one of the things we talk a lot about in naturopathic medicine related to fatigue. So if you have a really full day, you have a very prioritized day, and you know you suffer from fatigue, how can we actually break that day down so it's beneficial to us. So if we have, like a super important meeting in the morning and you're going to be fatigued after it, can we do something that's less exhausting afterwards? So we have this big meeting, maybe we're going to, take a 5-minute rest after, a 10-minute rest, or we'll eat our dinner or lunch then. And then moving on to the next step, maybe I know that laundry really exhausts me. We'll pair laundry with something resting after, and just kind of pacing our day so that we're not completely getting to the end of our day, we're completely burnt out and fatigued. We're actually having, these breakups in our day, and it takes a little bit of work, but it can actually work quite well and be very beneficial for people who suffer from chronic fatigue. These two tie into our activity management and prioritization. For nutrition in general, I did a webinar also on nutrition. That one is pretty well the same recommendations I would say here. We want something that is nutrient rich, well balanced, using whole foods, and then supplementation if that's necessary as well too. So like I said, with vitamin D, anemia, magnesium, if there are things that we can add in, that can be really beneficial. Progressive muscle relaxation, or PMR, there's again too always resources online for this, but it's essentially where you do a body scan and we're scanning the body starting from our toes. We're squeezing the toes as hard as we can and then relaxing them. And then we move up the joints. I'm going to squeeze my quad as hard as I can here for 10 seconds and then relax it. And then you go up the body, squeezing the abdominals and then relaxing it. And this can kind of help us come into a good state of relaxation, especially when we're going to bed. This is something that I always recommend people when they're going to bed, is to try this out. Mindfulness and meditation is something that we see, and then cognitive behavioral therapy is something that we also use for fatigue as well. So sleep hygiene and sleep aids, I'm like huge on sleep. I think it's one of the pillars of health. And when we talk about fatigue, talking about sleep hygiene and actually getting restful sleep, that 7 to 9 hours a night is really beneficial. So these are some of the rules. It's going to sound like I'm, reading off a rule book, but I truly believe and stand by many of these. But having a consistent bedtime, for one, is very beneficial. Having a consistent wake time, avoiding napping in the late afternoon. I always have a caveat to this for people with chronic fatigue, if possible. If you cannot get through your day without having, a 5-minute nap at 5 p.m., so be it. That's completely fine. But if we need a nap, usually, ideally, this is before 2 p.m., but if we can have that nap earlier in the afternoon, maybe having a 5-10 minute nap to get through the rest of our day, that's totally reasonable. If we can avoid napping in total, that's even more beneficial. But if needed, obviously utilizing those naps and trying to have it earlier in the day if possible. Having a bedtime routine. So establishing this bedtime routine and kind of psychological steps in our brain that prepare us for sleep have actually been shown to help with restfulness and getting into REM sleep very well. So if you shower before bed every single night, you read before bed every single night, dimming the lights is a fantastic way to kind of tell our brain, we need to start shutting off and we're going to start going to bed, is really beneficial as well too. So just establishing a good bedtime routine that works for you. So we're brushing our teeth, we're washing our face, we dim the lights 1 hour before we go to bed, and then we read our book, something like that. Avoiding eating and drinking before bed too. We usually say about 2 hours before you're going to bed. We want to be in full rest and digest. We don't want to be eating and having the digestive tract, working overtime as we are heading to bed. Also, just talking about the half-life of caffeine. I always tell people generally before 12 to 1 p.m., sometimes 2 p.m. at the latest. But the half-life of caffeine is quite long. So we don't want to be consuming caffeine and then that extends all the way into our sleep time and we're still metabolizing that caffeine from our body. So just taking a moment to actually, if you generally have a coffee at 5 p.m. or 4 p.m. or 2 p.m. or whenever it is, can we maybe have that coffee earlier in the day and just shifting the time of it? Limiting screen time is huge. Usually we say about 1 hour prior. If you can do even more than this, then that's fantastic. Cool environment, however, obviously we know with Raynaud's and Scleroderma, we don't want to be too cold, but we do see that if we lower our thermostat even just a little bit, that helps us actually get into better sleep too. So these, I always say, like, these are just fantastic ways if you're having trouble sleeping or having trouble finding restful sleep. This is like the complete basics of how do we actually improve our sleep, especially from a psychological level. And then going over this too, we're using the bed, we say, for sleep or sex only. So if you're having a hard time falling asleep, are we on our phone in the bed? Are we doing work in bed? Is fantastic, not fantastic, is, the absolute opposite of what we want to be doing, because we're establishing that brain connection of, oh, the bed is also for work, and now I'm stressed out when I'm going to bed. So we want the bed to be for sleep and sex only. Getting up when you're unable to sleep. So if you're idling in bed for a few hours and you just cannot get to bed, getting up, maybe reading a book, going through your notes, doing something else, like doing a little walk around your house, because we want the bed to be for sleep only. Hydrating throughout the day so that nocturia is not a problem. So we're not waking up to go to the bathroom, because that can often be a source of waking too. Making sure that we're comfortable, especially for people living with scleroderma, having a very comfortable bed, comfortable positions, and then also having good light exposure in the morning too. We know that this is super big for setting our circadian rhythm. So dimming the lights at night, especially a couple of hours before you're going to sleep. And then as soon as you wake up, trying to get that light exposure. Obviously, we live in Canada, so sometimes that can be really difficult depending on when you're waking up. But maybe looking out the window, trying to get some sort of light into your eyes can be really beneficial for helping us wake up and maintaining our routine. In terms of exercise, the general recommendation is 150 minutes per week. However, this obviously varies person to person. We're not all the same. We can't all hit 150 minutes. Many of us are living with disability too, so it makes this even more difficult. So as I mentioned, pacing the exercise, instead of doing a 30-minute walk, maybe we're breaking that down to 3 10-minute walks a day. And sometimes that makes it a lot more attainable too, especially if you work during the day and it's just hard to get those steps or that time in. And then also planning your exercise. So if after exercise you're extremely fatigued, maybe we want to plan our exercise around 4 p.m. or sorry, my cats are going crazy. If that after exercise you feel very energized, maybe we want to plan that earlier in the day or around the time that you're going to have a lull. So just being very intentional about when we want to plan our exercise, when we want to do it. And then also just looking at a couple of naturopathic sleep aids that we use. So chamomile, I'm sure many people are familiar with this one. You can get in a tea oftentimes, same with valerian. A lot of times if you buy a sleepy time tea, it's generally valerian. Usually it's a valerian, lemon balm, passion flower blend. And these can be very effective for sleep. Lavender is also one, as I mentioned, lemon balm and passion flower. Magnesium, as I mentioned, it helps with muscle relaxation, but also helping us to stay asleep. Melatonin, particularly if we have a harder time with our sleep wake cycle. L-theanine is something that I mentioned, I believe, in previous webinars as well too, but sometimes you can get it in chewable or capsule form. It's actually a derivative from green tea extract, and it helps us calm down. Same with GABA. And then, as always, cognitive behavioral therapy is first line, a lot of times for insomnia. General tips for fatigue too. I want to add this in. I was discussing with one of my friends who's in the program with me, and she has lupus. And we were saying, what do we actually use for fatigue and what is actually beneficial? But we were talking about the idea of using household tools and aids. And that sounds very, obvious, but sometimes we forget that they exist. So if you're having a harder time opening handles when you get up, not exerting yourself, having something that can help you with that, or shampoo pumps can be a big one, slip-on shoes, giving yourself extra time, pacing yourself, and just making sure you don't have this added stress of, you're not going to be able to do something or get there, and how can we kind of reduce that stress in our life? And then also having a support system is always first line. And I believe that was it. We'll move on to questions. Thank you guys so much for listening. I know that's always so much information. So if you guys have any questions, comments, feedback, or any just personal questions that you want to ask you are more than welcome to shoot me a DM, email me, etc. I'm always here for each and every one of you. But I'll probably turn it back to Michelle. Let me stop sharing my screen if I can do that here.
Yeah.
Okay,
Thanks.
I think we're good.
Thanks so much, Vanessa.
Yeah.
That was great. I was jotting notes, and validated on some of the things that I currently do already, and so
Yay.
that's always nice. I know we had someone made a comment, but I think it's more for the technical aspect. We were having our essay logo
Oh, yes,
on
yeah.
the bottom of the screen, so we can try to figure that out. But I'm
Workshop.
I'm not a techie, and so we'll figure that out. I know last month we didn't have that, so again, I'm not quite sure, but we'll look at it for the next time for sure. So I'm just going out to folks. If there's anyone that has a question to ask of Vanessa, that'd be great. No, I know you mentioned Mo and studying fatigue and so forth.
Yeah.
What is your knowledge on ozone treatments?
You know what? I don't actually believe they're in our scope as a naturopathic practitioner. They're kind of what's the word? Like controversial, I want to say. So we actually haven't learned anything about them in school thus far. I know sometimes for like autoimmunity or cancer treatment, they do use them, but otherwise I don't really know too much. Yeah, and like I said, it's a little controversial in terms of like alternative treatments. I don't necessarily know as to why, but yeah, sorry, I wish I could comment further.
No, I actually do that, and
Okay, yeah.
so I was just curious. Curious. I'm always curious. So let's see. Any other questions? How much vitamin D is recommended?
Okay, Cindy, you're gonna hate me. I legally am not allowed to give dosing. I know. So I always recommend for people get your vitamin D levels tested. It's a fat soluble vitamin. So if you just start blanket supplementing with vitamin D, there is obviously a safe level and a recommended dose. I think on most bottles they'll say like, oh, take 1,000 a day or take 2,000 a day because we know that's generally safe. But especially if we want a targeted approach to having your blood work is going to tell us how much we want to supplement. Like, you know, we see in clinics, sometimes I've seen people dosed as high as like 15,000 IUs or having even 30,000 IUs or have to get an injection. So it really just depends where your levels are at, I want to say, and just, you know, having the blood work done is really going to help with guiding that.
That makes sense. Let's have a look here. Oh, Q&A. Are there certain other things we should be looking at for levels in our blood work?
So do you mean in relation to fatigue or pain in general?
Let's say.
I would say for fatigue, what I had mentioned, anemia is a huge one. Obviously, if we're experiencing chronic fatigue, we kind of want to do the whole differential diagnosis where we're rolling everything out too. You know, is it a thyroid problem? Is it anemia? Is it depression? Etc. So we want to make sure that we're ruling out all of those conditions. That's one thing that I would say. And then supplementing accordingly if we are on the low level of having lower vitamin B12 or iron, etc. Iron deficiencies are huge, and I think they're almost in a way too normalized. You know, it's very common for people to go, oh, I'm anemic, or I used to think that too. I was like, oh, I'm anemic, whatever, no big deal. And it's like, no, you know, I'm not delivering oxygen to my body in a sustainable way, and that can have really long-term impacts, and life can be a lot better if we do just correct that small nutritional deficiency. So whether that's eating more red meat or using an iron supplement that we can absorb and digest is super key.
Okay.
Fatigue and chronic pain. Yeah, so chronic pain, I want to say again too, very individualized. So the fatigue I would recommend are nutritional markers. So we're looking at vitamin D, B12, anemias as well. Usually your doctor, regardless, since we have scleroderma, are going to be aware and want to look at these things anyways. In terms of chronic pain, it really depends where the pain source is coming from. We do have inflammatory markers. They're okay. And that would be our ESR and CRP, but do they necessarily relate directly to pain? Not 100%. So yeah, kind of just depends on what kind of pain we're experiencing, and just telling our doctor what pain we do have, and making sure that they're aware of it. And if they do think we want to do further investigations, that's when they would do it.
Great, thank you.
Thank you, Sydney.
All right, and let's have a look here. I don't see any other questions at this time. So if that is all we have, then I would say thank you very much, Vanessa, for your continued passion and information and expertise on your studies and your personal lived experience as well. Always appreciate it. And for everyone, we'll be back again in April 28th, I believe, understanding hormonal health in scleroderma care. So we look forward to having everyone back. And we again, thank you again, Vanessa, and thank you to everyone that's joined us this evening. And of course, when we're finished, we'll have a recording up on our YouTube channel, and you can always go back to view that again. So thank you, everyone.
Thank you, guys. Always a joy being here. And like I said, too, if you have any further questions, please feel free to shoot me an email.
Perfect. Thank you very much, Vanessa.
See you guys. Take care.
Bye.
Bye.